The hot flashes at 2 a.m. Mood swings that makes you feel like someone is living in your body. That brain fog that makes you wonder if you are losing yourself. What if I told you science now offers real answers, not just survival techniques for menopause? This isn't the end of your vitality. With the right reset, menopause can be a powerful new beginning. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the menopause reset, what science says about easing the symptoms. Let's dive into it. Menopause affects half of the world's population. Yet, for decades, it has been brushed under, and today, science is finally catching up. So we have not given it the attention that it deserves, despite the fact that it affects quite a huge population. So from hormone therapy to diet and even the gut health. Recently, I had a 49-year-old lady who came to see me. She was feeling exhausted. She was sleepless. She was anxious. She was concerned about her weight, which she thought was getting up. And also she thought she really was getting old. So, what was she experiencing? This is the biology of menopause. And once we reset her habits and explored the options that were available for her, we got her energy and her clarity back. 80% of the women experience hot flashes, and 1 in 3 struggle with mood changes. But most never get this evidence care. And the sad part of it, nobody also prepares for them that this is coming. So this gets us by surprise. Sometimes we think we are getting into menopause. Sometimes we think it's just something else that is happening to us. We don't talk about it. And so we get ourselves into menopause. We get the symptoms and they come to us like a roller coaster, and they hit us. The flashes, they keep you awake. They make you very uncomfortable. But you never knew that this would happen, and you did not know how to experience it. So before we talk the solutions, let's break down what menopause is. There is what we call the perimenopausal period, and this is the transition phase. It usually starts in the mid to late 40s, but can begin earlier. So if it begins between the ages of 35 to 40, then we talk about early menopause. And it lasts between 4 to 8 years. This period, the hormones fluctuate wildly, and the periods become irregular. So this could be some of the indicators that you could be getting into menopause. Of course, if you are using any of the contraceptive methods, these might affect these hormone cycles, and sometimes it can be difficult to recognize it. So some of the common symptoms that you'll find in this perimenopausal period will include hot flashes, night sweats, you have irregular cycles which just show up sometimes. You have mood swings, and you may have sleep problems and sometimes joint problems. Some of the other less common problems include things like awareness of your heartbeat. You may have migraines. You may have worsening of the premenstrual syndrome, and you may also have new onset of anxiety. Then now there's the menopause period itself, and this is defined as 12 months without your periods. And this can happen between the ages of 45 up to the ages of 55. Here, the estrogen hormone and the progesterone hormones are at their lowest. Common symptoms of these periods include vaginal dryness, painful sexual encounters. You may have brain fog. You may have weight gain around the belly, and also the thinning of hair, and also a dry skin. Then some of the less common symptoms include burning sensation in the mouth. You may have joint pains, and also you may have urinary incontinence, and sometimes urine frequency. Then the postmenopausal period. Postmenopausal means that the transition now has taken place, the period have stopped, and these are the years after the menopause. The periods have completely gone, and the symptoms may continue. Those symptoms of menopausal can continue, but in less severity and also in less reduced frequency. Some of the long-term risks in these postmenopausal periods include things like osteoporosis. Of course, there's an increase of the incidence and frequency of heart diseases in ladies. There's more likelihood of the increase in belly fat and also obesity, and also memory decline because of the loss of the estrogen protection that comes. And this is also the same thing, that loss of estrogen protection. The risk of heart diseases in females postmenopausal almost equals that of men. The phase lasts for the rest of the life. This is why it is managing it well is very important, because the moment you know what has taken place in your body and you take charge, then you'll be in control of what is happening to you. So menopause is not just a single moment. It is a journey through these three phases, which the symptoms range from what is commonly known as the hot flashes, which many people expect. Could also be things like joint pains, things like palpitations, and these could be what you are not expecting. So how can you be able to cope up with these symptoms and be ready for it? One of the important things that if we were to give one-stop treatment for menopause and the perimenopausal period treatment, and even the postmenopausal and menopause treatment, the core would be exercises. Exercise is so important because it helps in so many things in the control of these perimenopausal, menopausal and postmenopausal symptoms. It doesn't just help in the control of the symptoms, but it helps, one, in preserving your muscles. If you do strengthening exercises, if you do balancing tests to keep your joint healthy, and if you keep exercising the strength exercises, they help to reduce the chances of osteoporosis, that process of bone loss. And it is very critical that you keep exercises. If you want to know more about osteoporosis, you can check one of my previous videos on osteoporosis. So some of the other things that you can do, there is what was called previously hormone replacement therapy. But these days it's called menopausal hormone replacement. Menopausal hormone replacement. And this is very effective, especially if you have overwhelming hot flashes. It can help with the night sweats and can also help with the mood and the sleep. And it is important that you discuss this with your doctor so that you see whether they would be helpful. And there are various forms of hormone replacement that can be given. You have the patches, you have the gels, and you have the tablets. The gels and the patches are the more that are given more. And it works best if it is started less than 60 years or 10 years after within the onset of menopause. And the hormones help also reduce the risk of osteoporosis, and they also reduce the risk of getting heart attack and the overall mortality from heart attacks. So as I said, they come in patches, gels, or even pills, and these you should discuss with them, with your doctor and your health provider. The thing is, not every lady who requires a menopausal hormone therapy. It all depends on what are the symptoms that you have, because they are known to be effective in helping in hot flashes, mood stabilization, and also the night sweats, and also the insomnia or the sleep disturbances. There are also other non-hormonal empowering treatments. There are new drugs that have been shown to be effective in helping the menopausal symptoms. We have drugs like gabapentin, the selective serotonin reuptake inhibitors, which are used for depression. Drugs like fluoxetine have been shown to help with the hot flashes. And also, there are some research that is going on how you can delay the ovarian aging with the drugs like lapamycin, which help to preserve the tissues of the ovary. And so there could be hope that you can delay the onset or slow down so that this roller coaster effect of the menopause onset does not adversely affect you. Then there is also the lifestyle reset. This is my favorite, whereby, but of course, it is all goes with the discussion with the patient. It has been shown that eating more of the whole foods lessens the inflammatory processes that are associated with most of these hormonal changes that happen in our bodies. If you take less alcohol, less processed food, eating more fiber, making sure that you are protecting your gut microbiome with probiotics like fermented milk or fermented porridge, and also phytoestrogens like soy, they help in slowing some of the symptoms of menopause. Then there is also issues of exercise. Exercise, as I've said, it helps in managing most of the symptoms that are associated with the menopause. And you need to do aerobic exercises, you need to do strengthening exercises, and you also need to do flexibility exercises so that you improve the flexibility of your joint. Then there is also what we call the body-mind medicine. Things like cognitive behavior therapy, they have been shown to work. Things like hypnosis, yoga, and also mindfulness. They reduce the impact of the hot flashes and also help to improve sleep. If you want to know some of the things that you can do to help improve your sleep, you can check some of my previous videos, which include things like avoiding electronics before sleep, having a regular sleep program, and also incorporating some supplement like vitamin D3, K3, and also omega-3s, things like magnesium, and also I've talked about the soy flavonoids. Then there's limited evidence for things like black cohosh and the bioidenticals. So what can you do to lessen the impact of menopause on your life? One, track the symptoms by journaling. You can journal the cycle, you can journal the periods, how they have happened. You can also journal on the mood swings that you're having. You can journal about your sleep pattern. And you can also see the things that are triggering you into these mood swings so that you can be able to take control. Then talk. Discuss with your doctor about menopause, hormone replacement therapy, and also the non-hormonal options and whether you qualify for them, and also prioritize your gut health, have time for your exercises, have a balanced diet, prioritize fiber, prioritize whole meals, cut on refined and ultra-processed carbohydrates, and also work with the plenty of vegetables, which help to increase and improve your gut prebiotics and probiotics. And then movement, exercises. They cut across all the aspects of menopause, and they help prevent increase in weight. They help control the sleep and also that feel good feeling of exercising. If this gave you hope, hit the like button. Also subscribe to the Overall Health YouTube channel for more tips, and share it with a sister, a mother, or even a friend who is navigating menopause. If you want a guided health reset, you can always subscribe to the Health Insight 360 program through our Wellness Health Services channel, which will help you build a personal menopausal reset plan that will be able to help you become charge of what is happening with you. So menopause is not just an ending, it is a reset, and with the science, with the support, and also self-care, you can be able to thrive in this chapter of your life and transition to the next. So let's help you live a better life and make it more enjoyable. So share also your feelings, what has been happening to you through this menopause journey, how long has it lasted, and what symptoms have you been experiencing. And this could help another person who might not be knowing that menopause is coming in. We meet in the next video. Thanks for watching.